Good morning, my name is Vanessa. This is my PerioPoject. This is for the class Foundations of Periodontics for the Dental Hygienist. My instructor is Danny Walker, and as of today, I'm recording this 11/27 of 2024. So I would like to introduce you to my patient. My patient is Jared Fortin. He is 36 years old, height is 5'10", and weight is 218. His vitals have been ranging in each appointment from 117/78 to 130/90. His chief complaint is that his gums do bleed when he brushes, he flosses, and kind of at random. Something I did want to note about this patient, if you did not notice the similar last name, this is actually my husband. And something that I really liked about this project and him being my perio project was that I kind of got to see the process all the way through. Usually we dismiss the patient and they get to go home. But in this case, my patient was my husband. So I got to see him implement every tool that I gave him once we got home. So just kind of keep that in mind when you're watching the presentation, that I also got to see this from a different point of view that I actually thought was really insightful. So to start, my patient's medical and dental history really doesn't have anything. He doesn't take any medication. He is allergic to latex, but he has no systemic conditions, nothing really of worry. We also have, I know his blood pressure was 130/90, but he has gone and seen a doctor recently. We haven't been told anything. So other than that, my patient does have a history of smoking though. He started smoking at the age of 18. He's 36 now, and he smoked cigarettes up until 5 years ago. 5 years ago, he did switch to vaping, but that being said, he has never had a cleaning even before he even started smoking, so before the age of 18. So I knew that kind of going into this, I know that smoking was the main cause. His diet is pretty normal. We eat at home. We eat mostly whole foods, but my husband does enjoy the sweet treat nightly. And he also enjoys a soda randomly throughout the week here and there. His dental history though, besides his thirds being extracted, I never knew him to have any cavities. He ended up telling me that he had one cavity filling, and as you can see on his dental chart, it's number 14. He does have his distal cusp that has a small composite filling on it. He recently came into some caries, but even then they're tiny when I did his exam. He does have a few spots of decay, but that was something I thought was really interesting, was that my patient didn't have a lot of caries, but he had perio. So it was kind of different to see. You would kind of think going into it that you would see perio and then you would see decay, but they didn't really go hand in hand, at least in his case. So I thought that was really interesting and kind of cool to see. FMX was taken November in 2023, and in this image, I just wanted to show his radiographic calculus buildup. If you look at his bite wings, I should have done verticals. His bone loss was prominent, but his radiographic calculus is very, you can see the thorns. So that's what I wanted to show in this image, or images. So on this occlusion picture, I kind of separated this one from the rest of them because I wanted everybody to see his tissue. It's very red, very smooth, shiny, kind of more bulbous. It's not, the papilla's more blunted. And I really wanted to show this because you can see even the calculus in between his maxillary centrals. Like, if you later on, when I show throughout the presentation, there's the after picture of the same picture, and you can compare the difference. Right here, he's red, he's inflamed, and compared to the image later, I really just wanted to kind of just focus on this picture alone, just so that everybody can kind of see what we start with and then what we end with. These images are just his left and right occlusion, his maxillary and mandibular arches. On the scanner, I couldn't get the scanner to work right. That's why you see a couple of blue spots, but on the upper kind of like middle picture, you will see his calculus build up, and you can see it in the scanner. So I kind of just wanted to focus in on that part. So this was his perio chart. He basically bled every tooth. I want to say every tooth is either bleeding or had signs of inflammation. He had pocket depths of 4s, 5s, 6s, even 7s and 8s. I got cowls of 9. He had recession. He didn't have any mobility, but I could feel frications on every single molar, and as I've said, he bled a lot. It was pretty much every single tooth, if not every single site, majority sites on the teeth. So I gave him the diagnosis generalized stage 3 grade C, and I only gave moderate risk caries risk because of the recent caries. I honestly probably would have put him at low because he had never really had caries before, but the generalized every tooth was affected with bone loss. He had no missing teeth though, so he doesn't go into the stage 4 category, but we are going to keep him at 3. And grade C, because on the radiographs there is about 50% on at least a few teeth. So we are going to keep him at generalized stage 3 grade C. For planning and implementing, we're going to do 4 quads of SRD. We are going to use laser on this patient. We're going to do both LBR and LAPT in all of the pockets that are 5 millimeters and above. And then on his re-eval appointment, I placed a Reston, and we'll talk about that more in a second on the remaining sites that were still bleeding or still had deep pockets. We use Lido 2% with epi, and we did maxillary injections, mandibular injections, PSA, AMSA, and then I put infiltrations as needed because an issue that I had ran into with my patient was he wasn't staying them. Every appointment he was running through anesthetic or burning through anesthetic as it's the fastest I've ever seen. So that was a major learning curve for me. The patient had deep pockets, extremely tenacious calculus, deep calculus, heavy calculus, and then on top of that, he was burning through anesthetic. So that was a challenge, a huge challenge actually. And not only that, even when I was doing LAPT, I still had to give him the injections again. So it was a lot. I felt like I was racing against the clock, not as for clinic time, but more for the anesthetic for the patient. So that was something that was a learning curve, but good to know for getting out into practice. And then education for this patient was more at home care. The importance of a 3-month appointment for him because he was grade C. And then smoking cessation. Of course, that's the main one when it comes to this patient because I feel like the smoking played a huge factor with him. And I feel like that's the biggest hurdle. I know that for smoking patients, it's hard to quit. So kind of having that conversation, even though it is family, it's still hard to have that conversation, if not harder, to kind of get the message through of what is happening systemically and orally. This is my patient's current perio chart at his 4-week re-eval appointment, and I am actually extremely happy with this one. There is a couple spots that are still bleeding, but compared to the one from before, he's bleeding a lot less. I see a lot of reduced pockets. I'll show you in the comparison one I have in a couple slides. But I saw great reduction of inflammation, and we were bringing down pockets a lot. There is still some that are 4s and 5s, 6s even, but I saw a lot of 5s turned into 3s, and I'm extremely excited and happy about this. Recession did kind of get a little bit as the tissue was healing. I see a little bit more, but I'm extremely excited about these pocket depths, and I'm actually really excited about seeing a lot less bleeding. At least that tells me that the infection is going away or the bacteria is getting a lot less. So it also shows that my patient is keeping up on his at-home care as well. So I'm extremely excited about this perio chart compared to his previous perio chart from the initial visit. for the microscope, if you kind of focus on the center middle upper area, there's a lot of spirochetes. You can see the squirrely corkscrew kind of going across, and then when the picture turns a little more on the greenish blue side, you will see it looks like somebody flattened it out. So that was something that I thought was really cool, and I try to show kind of side by side the bacteria. Something that I really wanted to focus on these images, I like to show the before and the after, was just the comparison not only with calculus but with the tissue. The lower linguals, the anterior buildup, you can see night and day. As well as on the maxillary facial incisors. The reason why I put these two right next to each other was because if you look at the image on the left, it is bulbous, it's red, it looks inflamed, it's smooth, you can't really see any stippling if there is no stippling. But on the picture on the right of the same image, after it's clean, you can actually see the stippling coming back and the tissue looks healthier, it's pink. And I really like to see the side by side of it to really show where his interdental care has taken place. With this image as well, on the maxillary linguals, you can see the tissue looks red, if anything more on the magenta side. And then the picture on the right, it's getting to a color of pink again. It doesn't look as inflamed, or it doesn't, the papilla doesn't look as irritated as in the other picture. And then the mandibular facial incisors, you can see the tissue really look a lot healthier. It looks like it's coming back to a point. Stippling is starting to come back and all the calculus is removed. So I just liked showing the before and after comparison pictures. I think this has to be my favorite part of the entire presentation. I love this entire slide. I love seeing all the green. I do see one spot that the probe depth I got before was a 2 and now it's a 3. I told the patient that happens, especially once the calculus comes off. But I just see nothing but green, or if not the same, which I love seeing the improvement. Like, this was the best thing that I can see. And I think it kind of shows as a whole what both cleaning and laser and all of this does. I loved every second of this image. I even took, with approval, one bite wing on this patient to show the radiographic calculus that I had shown in the beginning of the presentation, to show the beginning radiographic calculus, how you can see it compared to this image where it's removed. But yeah, the pocket depths it's so great. I'm seeing 6s turned into 3s. I'm seeing 5 turned into 3s. I even have 7s turn into 4s. I think there's even one 7 that is a 3 now. Some of it did stay the same, but I just see nothing but improvements, and I am so excited. I love this image. I think it just shows kind of the end result of everything that we do. So I thought that this one was probably like the most rewarding for both me and the patient, both of these images together. And these are just his post-op pictures. This is one of the ones on the upper right, his actual occlusion. This is the one that in the beginning of the presentation I honed in on to kind of show his tissue. It was smooth, it wasn't stippled. He looked inflamed, and compared to this image right here, you can see the difference. It's looking a lot more pink. It's the tissue is starting to heal. I think it looks like night and day. And I love that. I love that I can literally see the improvement in his bite, at least in this image, and all the calculus is removed. So I love seeing the before and after pictures. And then this one is just an image of the comparison chart from the initial visit compared to the current visit, his re-eval appointment. To wrap up, I know I went over 10 minutes. There was just so much to talk about. I could talk about even more compared to the laser and everything that I did for this patient. But just to leave on the note of the post-treatment outcomes, there was reduced bleeding sites. We started at 109 sites and it's now 38. For Cation, I had 12 sites before and now I only feel 6 of them, so by half. Probe depths 4 to 5 millimeters were 78 sites and now they're 52. Cal depths that were 4 to 5 millimeters was 87, now they're 70. And and the improvements altogether, the 1 to 3 millimeter, which is what we like as healthy probe depths, we had 52 sites before. Now we're at 113. And then the cowl of 1 to 3 millimeters, we were at 39 sites, and now we are at 88. So, as I said, I can talk all day about everything that I saw. I think that for my patient, we both see so much improvement, and he's so excited to see how everything has worked. Now that the re-eval appointment has come, we did place a Reston in some of those spots that were continuing bleeding. So we're going to kind of compare for his next 3-month appointment what we see improvements on, if a Reston more worked for him or a laser. My patient really enjoyed the laser and he loves seeing the improvement. I just think that this kind of showed as a whole what we as students might see later on, how it all works, kind of every piece of the puzzle thrown in with this patient. I'm happy, he's keeping up on his care, and I can't wait to see for his 3-month appointment to kind of see where we can go from there, and if I'm even able to kind of redo laser in the remaining pockets. But I enjoyed this project. I thought that it was extremely insightful and educating. So thank you everybody for watching. I hope you guys enjoyed my presentation, and have a great day.